Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the Health Maestro. I'm nutritionist Ikra Mamoon and I'll be talking about symptoms of vitamin B12 deficiency. So before watching this video, do take a minute to like and subscribe my channel. Vitamin B12, which is also known as cobalamin, plays an important role in production of your red blood cells and DNA as well as for the proper functioning of your nervous system. But unfortunately, vitamin B12 deficiency is becoming very common these days. So, who's at risk of vitamin B12 deficiency? Firstly, the people who are following a strict vegan diet. That means they are just eating vegetables and avoiding meat and dairy products in their diet. Second are the elderly people. Thirdly, the people who have had surgery that removes the part of the bowel that absorbs B12. Next are the people on the drug metformin for diabetes. And lastly, the people who are taking long-term antacid drug for heartburn. Symptoms of vitamin B12 deficiency are often difficult to diagnose, but here I'll be sharing some common symptoms that will help you diagnose vitamin B12 deficiency. First one is pale or jaundiced skin. People suffering from B12 deficiency have often a paler or lighter yellow color of eye. This is basically due to deficiency of vitamin B12 that your red blood cells become so fragile that they break into a material, a brand-colored substance called bilirubin. And it is due to this substance that your skin and your eye color appears to be paler or yellower in color. Second is weakness and fatigue. Basically, the purpose of red blood cells is to transport oxygen around your body, but due to B12 deficiency, red blood cells in your body are not able to transport oxygen efficiently and result in weakness and tiredness. In adults, this type of anemia is also called as pernicious anemia. So what happens in pernicious anemia is that people suffering from it are unable to produce enough of the important protein called intrinsic factor that helps to bind vitamin B12 in your gut so that you are able to absorb it. Third is glossitis and mouth ulcers. Glossitis is basically an inflamed tongue and it often looks like smooth tongue with bumps on it. Some people may also experience burning and itching sensation or a feeling of pain and needles in their mouth. Next is nervous system damage. Vitamin B12 produces myelin that protects and insulates your nerves. So with deficiency of B12, nervous system isn't able to function properly. A common symptom of it is paresthesia. What's paresthesia? That's a prickling sensation in your hands and feet. Lastly, disturbed vision. When B12 deficiency can damage or affect your nervous system, it is likely to damage your optic nerve as well, leading to vision problems. To prevent vitamin B12 deficiency, you need to add more of vitamin B12 sources in your diet. Some good sources of B12 are beef liver, chicken breast, milk, egg, cheese and yogurt, fish like trout, tuna, salmon and sardines, or vitamin B12 fortified cereals. Now I hope you'll be able to diagnose B12 deficiency with these symptoms. Take a note of it. Take care and Allah Hafiz.